Hi, my name is Dr. Hossein Jahedi, and I am a cancer biologist at the University of Auckland, and I work in Dr. Emma Nolan's research group. So we work on a project related to breast cancer, and what we try to do is to actually take patient samples that are in the hospital and bring it into the lab and see what drugs they actually respond to, because we want to understand what the patients respond to before we actually giving them the drugs. The vision of our project is to create a system where we know what patients respond to in terms of drugs before the drug is given to the patients. So when patients undergo surgery and we have a bit of their tumor, we take it into the lab, we grow it, and we test different drugs on it to see what they best respond to, so they can get the right drug at the right time. The tumors that we're studying, so we're studying breast cancer, which of course is very common in New Zealand women. Also men, it's not very common in men, but men also get breast cancer, but it's mostly common in women. And it's very common. It's the number one most common breast cancer type. It's the number one most common cancer type in New Zealand women. We work with Auckland Hospital and the North Shore Hospital, so it's all the patients that are going through these hospitals, and they're women who are from New Zealand, including Pacific and Maori women that we try to include in our cohort, because that's just such a unique part of our population, and we try to make sure that that's represented in the studies that we do. Breast Cancer Cure has helped a lot. So Breast Cancer Cure has funded this really important part of the pipeline that we do. And it's allowed us to actually take these tumors and grow them on a sponge in the lab. So imagine the tumors that patients have in their bodies. We take them out and we can actually grow them in the lab and test different drugs on it. And that tells us whether that patient's tumor are responding to a specific drug or maybe is resistant to a specific drug. And that's what Breast Cancer Cure has funded, which is really important to the pipeline that we're trying to develop to help patients be treated better, I guess. So the goal is to treat women at the right time with the right treatment. So instead of patients receiving treatments based on studies on other people, we're trying to understand that specific patient's tumor and what that specific patient will respond to, so we can give them the right drug at the right time, so they don't have to go through drugs that may or may not work. So the good thing about New Zealand is that there's a really good community around breast cancer. So organizations like Breast Cancer Cure do an amazing job to raise money for breast cancer research, which is going to help the patients. If you look at the technology side, what we're trying to do in the lab, and it's really interesting, is try to map patient tumors. So imagine how Google Map works. You kind of know there's a shop lot next to a building and there's a school. So we're trying to actually map patients' tumors so we know what different cells there are and how they're linked to each other. And that's one of the newest technologies that we have, and we're trying to actually use that to understand breast cancer tumors a little bit better, so then we can develop drugs that are better than the one that we have. Because when we understand the patient's tumors better, we're able to develop drugs that are going to be better than the drugs that we currently have, and that's one of the things that we want to do. So I met Sonia, the CEO of Breast Cancer Cure, and I'm a dancer, so I dance. I met her at a dance event, and we managed to sell all these sweatshirts with like a dance thing background at the back, and that was really cool, and there were heaps of dancers who bought them. And I think people understand that it's a big problem, so they're willing to donate, but that donations does make a big difference to how patients who suffer from breast cancer are going to have better treatments, better ways of diagnosing kind of the cancer. So it is very helpful. So thank you. Can I look at the camera? Thank you to whoever's donating money or buying the t-shirts. It's really a big help.